Hello and welcome. Today we're going to discuss one of my favorite topics, the subject of veterinary advocacies. My name is Barry Kipperman and I teach the veterinary ethics course at UC Davis School of Veterinary Medicine in California in the United States. The objectives for our chat are to be able to cite at least 5 advocacies of the veterinarian, to cite veterinary student opinions regarding the advocacy preferences of veterinarians, cite at least 3 obstacles to assuming an animal advocacy position, cite reported advocacy behaviors of small animal vets, and be able to recognize conflicts in veterinary advocacy. In my ethics class, I routinely ask my students this question: why did you apply to vet school? To help animals, to help people who own or work with animals, to use your knowledge to help society, or to make money? And invariably, the majority of my students respond with choice A, to help animals, reflecting an animal-centered set of values. If we examine the standard bearer in the United States of what a vet is expected to achieve, we look at the veterinary oath, which tells vets that we are to benefit society, protect animal health and welfare, promote public health, and advance medical knowledge, with no guidance whatsoever regarding prioritization of our duties. It basically says, here are your duties, get to it, and good luck with all that. In contrast, in the UK, if we look at the RCVS Oath of Professional Conduct, it states, I will pursue the work of my profession and accept my responsibilities to the public, my clients, the profession, and that above all my constant endeavor will be to ensure the health and welfare of animals committed to my care, a very clear contrast from the AVMA oath. If we look at another U.S. Code of Conduct, the Principles of Veterinary Medical Ethics, this is a very long document which primarily centers on issues such as collegiality and marketing. With regards to advocacy, it states that a vet shall be influenced only by the welfare of the patient, the needs of the client, and the safety of the public. And in one brief sentence, the principles state veterinarians should first consider the needs of the patient. So one could argue, at least here in the United States, that our codes of conduct really do not provide veterinarians much guidance in addressing who our primary allegiance should be. If we consider a list of all the interests you may be influenced by as a veterinarian, we think, of course, about the animal owner or caretaker, your interests as a veterinarian in career satisfaction and professional advancement, the interests of your employer, which often centers on practice profitability, your interest in making money and financial compensation. In some lines of work, there may be an interest in serving public health, satisfying referring veterinarians, or publishing papers. And last but not least, of course, our patient, the animal. So with the interests vets are expected to serve on the left, and the advocacies in the veterinary oath on the right, does anyone see a path that clearly delineates how we're going to prioritize these interests? Or are we going to spend much of our career like this person in the figure, with your arms out, balancing all of these interests? Rollin has noted that a fundamental ethical problem in the profession of veterinary medicine is whether vets should give primary consideration to the animal or to the client. In his book Veterinary Ethics, Jerry Tannenbaum observes that veterinarians are the servants of 2 masters. So if we consider Rollin's fundamental question, if we look at the left of this schematic, we see a veterinarian acting as animal advocate, analogous to what Rollin refers to as the pediatrician model of veterinary medicine. Alternatively, if we consider the diagram on the right of this cartoon, the veterinarian must accede to the requests or demands of the clients regarding the animal, who is considered their legal property, And in this role, Rollin analogizes that the veterinarian is analogous to a garage mechanic. So as we consider this issue and Rollin's fundamental question of who the veterinarian owes primary allegiance to, I want to bring up the case example of Queenie. Queenie was a 6-month-old cattle dog I met in practice many years ago. At the time, Queenie lived in a rural part of town on a horse ranch. Queenie was brought into her local veterinarian on a Monday for acute onset coughing. Radiographs were taken, and Queenie was sent home on antibiotic with a tentative diagnosis of pneumonia. The following day, Queenie's owner noted that her condition had worsened and she was coughing up blood, at which time Queenie was referred to me. And at arrival at my practice, Queenie was in real trouble with a classic orthoptic posture and cyanotic mucous membranes. Based on the signalment and history, I suspected that Queenie was bleeding into her lungs as a consequence of rodenticide toxicity, anticoagulant rodenticide toxicity, and indeed the owner confirmed that rat bait had been laid out on the ranch. At that point, I discussed Queenie's critical condition. I provided a 75% prognosis for complete resolution of signs with immediate intensive care. I laid out the treatments that would be necessary, including oxygen, IV fluids, blood products, and vitamin K. At that time, Queenie's owner told me that if I could not improve her condition for less than $1,000, we would have to end her life. The question now becomes, have I satisfied the veterinary role as animal advocate here, or should I go further? Should I offer to discount my services? Should I offer to provide care at no charge? Where does the role of animal advocacy begin and end? With regards to this question, I published a paper in the Journal of Veterinary Medical Education, and we surveyed 284 vet students from 4 different U.S. schools, and we asked them, when the interests of clients and patients conflict, whose interest do you believe should be given priority by veterinarians? And 92% of vet students felt that the animal should be given priority. But when asked, when the interests of clients and patients conflict, whose interest do you believe is most often given priority by veterinarians? 84% of students responded the client. And I suggest that the recognition amongst these students of this conflict between the ideals of veterinary students and their perceptions of veterinary behaviors is a setup for disappointment and disillusionment among veterinary students. I will argue that in the conventional paradigm of veterinary practice in most societies, the veterinarian is a medical counselor advisor who forms a relationship with and works on behalf of the animal owner. David Main notes that normally the vet decides what should be offered or recommended to the client. The RCVS Guide to Professional Conduct states that vets must accept that their own preference for a certain course of action cannot override the client's specific wishes other than on exceptional welfare grounds. Animal advocacy has been defined as a mindset or a philosophy of practice. Simon Coughlin notes that animal advocacy is the preparedness to engage in the full gamut of justifiable advocacy options required for preventing harm to patients. Strong patient advocacy involves a disposition and a moral stance orientated toward the goal of improved patient well-being and an embrace of the range of justifiable ethical means and resources that vets have at their disposal, suggesting that veterinarians should utilize all available resources to maximize patient outcomes, which means that in the example of Queenie, perhaps I'm obliged to direct the client towards any and all available economic resources to assist in trying to get Queenie better. Some suggest that veterinarians should be primarily advocates for animals. In his book Veterinary Ethics, Jerry Tannenbaum notes a vet's obligation to permit a client to make the decision about care for the patient does not preclude the doctor from presenting oneself as an advocate for the animal and offering on its behalf arguments against the apparent tendencies of the client. David May notes the goal here should be to optimize the welfare of animals while recognizing that animals have owners involved in the decision-making process. So how do we balance the conventional paradigm that veterinarians are client advocates with the student consensus that vets should take on an animal advocacy position? There are a number of obstacles to the animal advocacy position. There's a lack of clarity in AVMA, and I suspect codes of conduct in many other countries as well regarding the role of the veterinarian. Veterinarians are hired by humans, not by animals. We are paid by humans, not by animals. And animal advocacy can be time-consuming and emotionally draining. David Main notes that vets have long been perceived as animal advocates, and yet their income is usually dependent on a third party, the owner. In an ethnographic study of small animal veterinarians in the United States, Morris concluded in her book Blue Juice that because animals are legally considered property and vets depend on clients for income, veterinary medicine is more client-oriented than patient-oriented from both a legal and practical standpoint. In 2018, I collaborated with Patricia Morris and the late Dr. Bernard Rowland, and we published a paper in the Vet Record looking at the ethical dilemmas of small animal veterinarians. The goals of our study were to determine how often ethical dilemmas were encountered between serving client and patient interests, identify the common circumstances that cause ethical dilemmas, determine which interests do vets prioritize when client and patient interests conflict, and determine the degree of moral stress elicited by these conditions. So we asked small animal veterinarians, when the interests of clients and animals conflict, whose interest do you believe is most often given priority by small animal vets? So we're asking vets about the advocacy behaviors of their colleagues. And you can see here that 49% believe that colleagues prioritize client interests, and only 17% felt that colleagues prioritize patient interests. When we ask the question a different way, when the interests of clients and animals conflict, whose interests do you most often give priority? So we're asking vets about their own individual advocacy behaviors. 50% reported serving patient interests, and 16% reported serving client interests. So a complete reversal. In these perceived individual advocacy behaviors, there were no significant differences based on years of experience, gender, or whether one was an associate or a practice owner. Sociologists are aware of a concept known as moral hypocrisy, where people perceive their own questionable behaviors to be less objectionable than the same behaviors performed by others. So what that means is that inevitably when people are asked about their values, we tend to exaggerate or sanitize our own self-reporting. I would argue that this data does not represent a flattering portrayal of the veterinary profession in the United States as being primarily advocates for animals. And these findings have recently been substantiated in a number of other studies. In a 2018 paper, Lisa Moses found that 60% of veterinarians reported prioritizing the needs of animal owners over patients. In a 2021 paper, Ann Quain found that only 48% of surveyed vets and vet techs reported that their primary obligation was to the animal. And in a study by Springer out of the European Union, they concluded that a client-centered orientation was more prevalent than an animal-centered orientation among veterinarians in the European Union. So I want to end this discussion by looking at, in my home state, the California Veterinary Medical Association Principles of Animal Care and Welfare. There are 8 of these principles, and the 2 listed here relate to veterinary advocacies. The first states that animals' interests should be given thoughtful consideration when determining acceptable care, use, and welfare. This requires balancing of scientific knowledge and ethical, philosophical, and moral values. The second principle states that acceptable care, use, and welfare of an animal may not always serve the individual animal and should be balanced by the greater benefits to other animals, humans, or society. And I'd like you to consider looking at these 2 principles and ask yourself whether you feel that they reflect an animal advocacy position or a human or client advocacy position. And I want to end on an optimistic note by going back to the United Kingdom and looking at the RCVS Code of Professional Conduct for veterinary surgeons, which states that on occasions the professional responsibilities in the code may conflict with each other, and veterinarians may be presented with a dilemma. In such situations, veterinary surgeons should balance their professional responsibilities, having regard first to animal welfare. So in the UK, their code of conduct clearly clarifies whose interests should be prioritized, which is a step in the right direction. So in summary, veterinarians serve multiple advocacies, of which the 2 most fundamental are the interests of the client animal owner and the interests of the animal or patient. In the United States, there's no consensus among small animal veterinarians regarding prioritizing animal versus client advocacy when these interests conflict, and I would argue that the codes of conduct in the United States regarding this issue are equivocal and unclear. I will also argue that veterinary advocacy preferences have very important implications for animal welfare. I will argue that animal welfare cannot be advanced by the veterinary profession until the profession pursues a position that reflects advocacy for animals. So I hope that this has been a thought-provoking discussion, and I appreciate your time. Thank you.